Let's get started. Well, everyone, I am so thrilled to have George Miletinitz here to speak with us about the language of recovery and gambling stigma. And just to share a little bit about George and his wonderful career. He has worked in the addictions and mental health field for over 40 years. George is a licensed clinical alcohol and drug counselor and an international certified gambling counselor. He has spent 30 years in various capacities, including treatment, prevention, with the New Jersey Department of Human Services, Division of Mental Health and Addiction Services. And after retiring from the state agency, George became the Assistant Director of Clinical Services, Treatment and Research for the Council on Compulsive Gambling of New Jersey. And although George has retired from CCG&J in 2020, he remains active in the field as a clinical consultant and trainer and writer. Additionally, he serves on various coalitions, including the Association of Professionals Treating Problem Gambling, the New Jersey Association of Mental Health and Addiction Agencies, and the Mercer County Psychological Association. So thank you, George, for spending time with us. And I also want to encourage everyone. George has stated how he likes his presentations to be interactive and to be able to respond to questions or comments you all have. So please feel free to be engaged. So George, with that, I'm going to let you roll.
Thank you, Carolyn, for such a warm welcome and for having me today. And for all of you and taking time out of your busy schedules to be with us today. I always get excited when I talk about this topic and meeting people in the field. So I just want to reassure you a couple of housekeeping things that no need to worry about if we kind of glide through some of the slides. They're available. Certainly, if you like the slides, the whole PowerPoint, it's all yours. And also, as Carolyn said, if you could, feel free to jump in at any point in time. I'd be glad to answer questions, see your comments in the chat box rather. So whatever we could do together. My motto is that we learn together. So again, let's talk about stigma. But before we even talk about the PowerPoint here, what interested me in stigma, what got the spark going in me? Oh, about 6-7 years ago, I was attending a national conference, National Council's conference on problem gambling. And Dr. Lori Rugel, a noted authority in our field, she had done a workshop on stigma and language of recovery. And holy smoke, wow, it was an eye-opener for me because I just didn't realize the importance of words. And boy, are they important. And attitudes and biases and things like that in terms of our toolkit and really how we need to be able to be mindful of what we say and how we say it to our clients. Dr. Rugel really got me into it. She gets the credit for it. Also, another thing that really kind of opened my eyes was when I was at the council in New Jersey, the council there, part of my job was to take the helpline calls, and we had the 1-800-GAMBLER number. And again, I learned so much in taking those calls from individuals calling in and also family members, because they're often calling in too for help. And almost, well, I'll say most of the time in handling those calls, there was a level of stigma, an undercurrent level of stigma in the conversations with those individuals. And oftentimes it took them a long time to make that first call because they were fearful of being judged, fearful of feeling disgraced, feeling stigmatized because of their disorder. So yeah, that was an eye-opener for me in that regard. And I learned a lot about stigma and its impact on clients. Stigma goes way back, though, in our field. We just didn't recognize stigmatizing terms. Back in the day, there was a term MICA. Anyone remember that term? MICA, the MICA client? Okay. MICA stood for mentally ill chemical abuser. And you talk about a stigmatizing term, that was one of them, mentally ill chemical abuser. And to top it off, those individuals were sent to special self-help groups which were called double trouble meetings. Okay, so imagine that you're in a rehab, and over the intercom they say all those MICA clients report to room 2 for their double trouble meeting. Pretty stigmatizing. But again, the field, and this is no disrespect to the field just didn't know any better. And this was back in the 80s into the 90s, these terms. And also stigmatizing philosophies. I remember working when I worked in treatment. I remember some treatment programs, because I worked in detox for a while, some treatment programs would say, oh, you know, if you're on psychotropic medications, you can't come to our program because you're just chewing your booze. And it was those kinds of messages that were sometimes sent to clients that were not helpful. But again, the field was still learning a lot about where it was going, and a lot about language too, and a lot about treatment. So that was the past. I think things are getting better now. I really do. I think there's an improvement in language. 2017, the Office of National Drug Control Policy came out with, you know, the new language of recovery. And we'll go into that a little later. But that's when a lot of this started to kind of turn around and really become a focal point for our treatment field. So let's jump in. Okay, I'll quickly through the objectives. Okay, to understand the powerful nature stigma, define stigma, its importance, and its impact on our clients, describe and avert and stigmatizing language, embracing the terms language of recovery terms, and the most respectful way of referring to people is as people approaches. Okay, and learn ways of combating problem disorder gambling stigma through stigma reduction initiatives, and learn how to destigmatize your workplace. That comes towards the end, but I really want to make sure I try and have enough time for that, because that is something that, again, we're all here for. The ground rules are what they are. Respect is the key. And if there's anything here that you need, any messages, any screens that you need to walk away from, please do so. The origin of the word stigma. Okay, stigma, plural stigmata, is a Greek word that in its origins referred to a kind of tattoo mark that was cut or burned into the skin of criminals, slaves, or traders in order to visibly identify them as blemished or morally polluted persons. And some clients do feel like they're blemished, morally polluted, inferior, having character defects. Some more on stigma: a market disgrace. It sets a person or a group apart. Social groups are devalued, rejected, or excluded on the basis of socially discredited health conditions. I want to quickly take us back to the AIDS, HIV/AIDS. Well, when it hit the country, I believe in the 80s, and how individuals affected by HIV/AIDS were, let's say, they weren't given the best medical care. Let's say they were excluded. Let's say they were stigmatized. Let's say there was great fears amongst dealing with people with AIDS patients, HIV patients. Really a condition that was, oh my goodness, affecting the whole country in one way or another. And we're going to come back to that much later in the presentation, because there's a key part of the presentation that I want to link this up with in terms of groups being devalued. Okay, the next one, most experts agree the biggest barrier to addiction treatment faced by clients is stigma. How true is that? So oftentimes the reason they don't come to treatment. Many people living with addiction and or mental health disorders say the stigma they face is worse than the illness itself. Imagine that. The stigma that they're facing, experiencing, it's worse than the illness. And we know how terrible the illness is. The individual carries shame, for example, feeling like a failure. Family members are also stigmatized. 74% believe that gambling problems are caused by lack of willpower. Wow, that's to me that's startling. That society, 74% believe this lack of willpower, and that's the NCPG NAGE, National Council on Problem Gambling, and the NAGE stands for the National Survey on Gambling Attitudes and Gambling Experiences. And that survey was done in 18, and then it was followed up again in 21. 1 in 4 Americans believe that those with a gambling problem are unlikely to recover. 1 in 4. Another 1 in 3 are not sure. I don't like those numbers, and I don't think you do either. It is generally believed female problem gamblers feel much more stigma than male problem gamblers. Certainly true. And if you have many female problem gamblers, uh, I, I, I tend to think that you might agree with that. Some more fallacies of disordered gambling, substance use, and mental health disorders. Okay, disordered gambling is a choice, not an illness. Okay, again, these are fallacies. Disordered gambling reflects lack of willpower or is a weakness, something we just said. Substance use disorder is a choice, not an illness. Again, substance use disorder being a choice. Individuals with mental illness somehow caused their illness and can stop at any time. I remember back in the day, there was this one of the sayings was just snap out of it, like the person who might be severely depressed or going through an episode of another mental disorder, they could just snap out of it like that. Falsehoods and ignorance, for example, mental illness and violence go hand in hand. Well, sometimes they do, but many times they don't. And that's something I think we're aware of, but somehow I think it's often glamorized where, people with violent crimes, committing violent crimes will automatically be considered mentally ill. Not so. Stigma is the missing piece in our nation's response to the addiction crisis. Very true. Powerful addiction to stigma, and let me tell you, it's not a joke by any means. Addiction is giving up everything for one thing. Recovery is giving. I like this one. I kind of think it says a lot, and it's so true. And I often will share it with clients and families that I work with. Gambling addiction quickly, again, $14 billion annually is the estimated cost. This comes from the National Council on Problem Gambling. Cost to families, communities from bankruptcy, divorce, job loss, healthcare, and criminal justice. That's a staggering amount a year. Primarily due to stigma, less than 8% of individuals with gambling disorder will ever seek treatment. Less than 8%. That's not a good batting average. Not at all. Cost of substance use disorder is greater than $820 billion a year and growing. And here's the upshot of all this. If stigma is permitted, it will prevail at continued expense of communities and also lives. I want to add that. And stigma, again, there's still, in my mind, there's still too much of it out there, but we're working towards dismantling that. Mental illness is nothing to be ashamed of, but stigma and bias shame us all. That's former President William Clinton. Belief that a little bit about mental health stigma, belief that revealing a criminal record to an employer is less deleterious than revealing a mental illness. Think about that one. All right. Trying to, again, not being able to talk about mental illness, fearful that they're going to be judged an individual or be outcast. Some individuals with mental illness are most creative and imaginative. I know I'm going back a long ways with this. Okay, Lincoln, I believe it was severe depression, and Churchill, I believe bipolar. However, there are many, many individuals in society today, prominent individuals who've also worked through some of the mental illness that they've had and also addiction issues, including gambling. Mental health stigma, a little more. Nearly 9 out of 10 people with mental health problems say that stigma and discrimination have a negative effect on their lives. That's a lot of people, 9 out of 10. saying it's affected their lives. This often makes people's mental health problems worse by delaying or stopping them from getting help. That's why we must continue to challenge stereotypes and advocate for those experiencing discrimination. And that's a key point, too, in our PowerPoint. We'll come back to a little later about advocating and talking about stigma and when we hear it, and being able to help educate society and people in our field and clients, too, especially that stigma, we can work with stigma. We can help you in your feelings of stigma and shame. As defined by Brown, a research professor at University of Houston, shame is an intensely painful feeling or experience of believing that we are flawed and therefore unworthy of love and belonging. And I'll tell you, a lot of those helpline calls that I used to get on the 1-800-GAMBLER number, those people did feel flawed and unworthy and almost feeling like they're not worth getting treatment. They're not worthy of it. Guilt says I've done something wrong. Shame says there's something wrong with me. Guilt says I've made a mistake. Shame says I am a mistake. Guilt says what I did was not good. Shame says I am no good. John Bradshaw, the famous author, I think he says it well, differentiating between guilt and shame. Okay, I don't see anything yet. Maybe there's one thing in the chat box. If there's anything, uh, let's see, that we'll come back to shortly. I'll just go over the types of stigma. Internal self-stigma, when individuals feel shame and negative thoughts about their membership in a particular stigmatized group. And that could be, again, that could be the AIDS, HIV group that I mentioned before. People may avoid seeking help, fearful others will judge them, most definitely. External enacted stigma, the experiences of how we stigmatize others, judging, and making people feel less than human, okay? And the judgment and the issue there. I just want to share quickly on that about attitudes and biases. I remember having attended a training session many years ago, and it was for counselors and social workers, nurses, and it was on attitudes and biases, and the instructor started out the training by saying how many individuals, the room maybe held 30-35 people, how many individuals here feel they have attitudes or biases, and I think only maybe 2 hands went up, okay? And so the instructor, who's quite quite bright, she said, "Okay, let's start this all over again and be honest with ourselves. How many of us feel we have attitudes and biases?" And wouldn't you know, maybe all the hands went up, but 1 or 2 people. And the instructor then said, "That's much better." And it's so true, isn't it, when we think about it? I think Father Joseph Martin, the pioneer in the field of addictions, alcoholism specifically, and drugs back in the 80s and 90s, and his videos, guidelines and chalk talk, I think one of his comments was, our attitudes die about 15 minutes after we die. How true is that when we think about it? And I think later in the presentation, we'll talk a little bit about how we have to check ourselves for our attitudes and for what prejudices and what biases we might be carrying, even unbeknownst to ourselves. But that's important because that sometimes has a lot to do with how we speak with our clients, how we review or how we view our clients. Stigma from recovering community. Okay, recovering people stigmatize one another. Oh, they certainly do. And we think about in the field of alcohol use disorder, sometimes, I only drink beer. I can't be that bad. And I'm saying that there, I see a couple down. That kind of thinking. I'm not as bad as the person drinking the hard stuff. Or I only play scratch offs and do not go to casinos. Okay, I think you've heard that one too, working with problem gamblers. thinking they're not that bad. Okay. Quick story. I remember taking one of the calls at the council, and the person called in looking for a meeting, a GA meeting in South Jersey. And I gave them the location of it. And that particular GA meeting was being held at a hospital, which also had a behavioral health component to it. Actually, the GA meeting was held right within that unit of the behavioral health system there. And when I said that to the client, because they said, "What room do you go to?" And I pointed it out to the person on the phone, the caller, and they said, "Oh," quickly, they said, "Oh, I'm not going there." And like, in parenthesis was, "I'm not going to be caught dead around anybody who's going to a behavioral health program." So here you have a person calling the 1-800 number for gamblers helpline, and they're stigmatizing individuals going to a behavioral health program for mental health disorders. But it happens. Let me tell you, that kind of stigmatization does occur. Stigma from treatment providers. Again, at the bottom, some staff members from abstinence-oriented programs believe that maintenance programs involve trading one drug for another. And we could go through that one. That's a whole nother, presentation with medication assistance treatment, but that's another issue here that sometimes comes to light. Addict. Okay, this isn't important. It's a bit wordy, but it is not for us to define how individuals who have an addiction and or a mental health disorder or those in recovery choose to identify themselves. That's not our call. But for many people in early recovery, the term addict is a helpful way of identifying symptoms and issues and finding a way to connect and bond in a healthy way that promotes change. However, and this is the key part, I think, that the addict label suggests that the whole person is the problem rather than the problem being the problem. I'd like to just stop and any comments, any thoughts on what's been said to this point, even on that term addict, which is a commonly used term in our field, very commonly. Anybody have anything to add on that in the chat box, or would like to just chime in? Carolyn, do you see anything?
George, I have a comment, if I could, please.
Please, Don, yes.
And that, I remember back in the 70s, because that's 77, 78, when I first started working in the field of addiction. And it wasn't uncommon for us to say addicts and separate addicts from alcoholics. And that the addicts for somehow were not as good as the alcoholics. and yet we all talked about that alcohol is a drug, but if you're addicted to cocaine or marijuana, and that somehow you were worse than an alcoholic. And I always thought it was interesting and fascinating. That's what we did. Even like, fortunately, I trained at Hazelden for their addictions, for my addictions background, and they did the same thing up there.
Yeah,
it was fascinating, but that's the way it was back then. Thank God we don't continue to do that.
God, Don, good point. Really good point. Things have changed a lot, haven't they? And I can remember back in the day. Now we have, celebrations in drug court or recovery court, whichever is the name in your state. I remember back in the day, though, when individuals graduated from their drug treatment program, that they would have a big party and there was alcohol served freely at the parties. To your point, Don, to your point, it was like, yeah, it was just a totally different time. And again, not at all criticism of the field at that time. The field just didn't know enough.
It's George, you're right. That's what we knew, because when the first substance use disorder counselors, they were primarily alcohol, and you had a few other drugs in that bunch, but very few of them had any form, and I don't mean disrespectful, no, they didn't have any formal education. They just got taught what they knew from each other.
Excellent point, Don.
And I will say, you know, even though much change has happened, we still see some of this. It's not unusual for some of our helpline callers for their significant others or some other family member to call and ask about, you know, celebrating this person's recovery with trips to Las Vegas or something like
There you
that.
go,
So
Carolyn.
it's
Yeah,
still
yeah.
happening.
It's still happening, Carolyn. It's so true. That's so true. Excellent points from both of you. Thank you. Thank God things have changed over time, going in the right direction, but we still need more change, right? And that's what we're
I,
striving for.
I had one
Oh,
more piece, and that was about the problem gamblers. Because we didn't recognize a lot of problem gambling back in those days. And when we did, this is a quote, those damn gamblers.
yeah, yeah. Or degenerate gamblers.
Mhm.
Yeah, yeah,
Uh,
yeah, yeah.
and you know, to your point, Don, we still don't, in my mind, we still don't recognize it nearly enough. I still have parents that I work with who, you know, they'll tell me, well, you know, at least my son, you know, he's only in high school, and he's not hanging out at the malls or running the streets. He's downstairs. He's not drinking. He's with his friends, and they're just playing cards.
Yeah.
And, and like, I mean, you've heard that time and time again. And sometimes those seeds are being planted at an early age. And the parents are just thinking, well, you know, gambling's not as bad. So let's stay with gambling. They're home. They're not out there. I know where they're at, and they're okay. And
They're
many
not
times,
ingesting a substance. Yep.
there you go, Carolyn. Exactly. Exactly. So that's why we work towards what we work towards. And let's do a little, and thank you for sharing those thoughts. Much appreciated. Recovery. Okay, a little, this is one of the wordiest screens I have, I think, maybe one more, but recovery is a paradox. During treatment and early phases of recovery, saying the words, I am an addict, is a powerful way to help people understand that their lives have become unmanageable and that they need help. However, during the latter stages of recovery, the same phrase can prompt some people to define themselves solely by their addiction, something I just said again in the previous screen. Apologies. The challenge for addicted people, their families, and those who treat them is to recognize that while self-identifying as an addicted person can be liberating, viewing oneself only as an addicted person can be self-limiting. A quote from Richard Landis there, a program out in Maryland. This quote goes back to 2014, I think, and Mr. Landis, I think he knew what he was talking about back then. Cultural differences can affect language of recovery. Some individuals in recovery, depending on their environment, may choose to call themselves a clean and sober addict as a badge of honor. And that's true, and that's good. That's nothing, there's nothing wrong with that. You hear it in self-help meetings. You often hear it, and it's their identity. And again, it's not our call. And if they would like to call themselves whatever they would like to call themselves, for whatever reasons, the cultural differences are very significant. And we have to learn and appreciate that, not just learn it, but we have to appreciate that. So again, the person, again, identifies themselves as they so choose. Much public stigma exists regarding problem disorder gambling. Still, it's alive and well, stigma, unfortunately. Female problem gamblers feel twice the amount more stigmatized than male problem gamblers. Stereotypes, problem disorder gamblers are often seen as the following. Okay, I don't have to read them, you see them. And there's another list there that could match that one, but expressions of individuals experiencing gambling addiction or self-stigma is very debilitating on an individual's help-seeking behavior and recovery. Can't tell you again how many calls that came into the council where the sense of stigma, the feeling of being excluded, isolated, shamed, discouraged, all those words just came through in conversations with people. And stigma is generated and perpetrated by prejudicial attitudes and beliefs, something I talked about before, how we all have on some level, some type of attitude or some type, okay, of feeling inside ourselves that we have to check out. that we have to learn, especially working with people, because words are all we have. Think about it. I mean, surgeons have their tools in the operating room and all to do their precise work. Our work is through words. And of course, modeling behavior when we're with the client one-to-one, how we attend to them, the body language we show. But it's really so much is what we say and how we say it, the tone. And we'll get to that a little bit later. Words have power. Otto Wall, professor, University of Hartford up in Connecticut. This is all he does. I don't mean only. He studies this. This is his field. Words have the power to teach, the power to wound, the power to shape the way people think, feel, and act towards others. Our words have that power when we work with clients and their families. Words are important. If you want to care for something, you call it a flower. But if you want to kill something, you call it a weed. Don Cohese. Don works out in the Midwest somewhere. I don't know exactly where, but he's a SUD counselor, and he does great work, as you could tell from his quote. Okay, a quick vignette here. I went to an emergency room one time, and a lady came back after checking my record and barely talking to me. She said, "Well, there's nothing we can do. We can't help you here." And she didn't even get to talk to me. She was going only by my records. This is a true account of an individual with a history of substance use disorder. It discusses an experience of stigma in a healthcare setting. And let me tell you, this is still alive and well, unfortunately. In fact, they've done research on it, and they've found that the medical records oftentimes contain stigmatizing language. Okay, drug abuser, okay, alcoholic, okay, and they found that those patients who have medical records without stigmatizing language often are cared for better and often respond better to their care. Something to think about for medical staff. This comes from a study, and I'll quickly refer back to Chalk Talk and Guidelines, the Father Martin videos from back in the day. There was one vignette in there where the emergency room nurse, okay, there was a quick spot on there where the way she treated individuals coming through the ER with any type of alcohol problem. Okay, could have been alcohol poisoning, it could have been just ingesting alcohol and drugs, whatever the case was. How she treated those patients coming through. And let me tell you, she treated them with disdain and utter contempt. And the reason behind that was that nurse had grown up with an active person, her dad, with an alcohol problem. Okay. And she never was able, unfortunately, she was never able to work through those feelings she had and still carry them into her work experience as a RN in an ER and treated clients accordingly. That's why I say it's important for us to check ourselves, and we'll come back to that a little later. Okay, I didn't come up with the struck tragically. That was from a client of mine. My wife and I did the stigma on the person's back, the world of stigma that they're trying to carry. But that came from a client, and I don't think it could be said much better. Persons are often stuck within their stigma and stuck in their addiction. One of the best posters I ever had when I started in the field, and again, I go back to, I'm back here in the 70s as well, and this came out in the late 70s, and it was from NIAAA, okay, and it showed a typical American alcoholic. Oh, wow, I thought this was the best poster, and it was. It was at the time, and I'll tell you why. Because it destigmatized individuals, okay? It showed, you could be from any walk of life, any nationality, ethnicity, age, and here you could have the problem. Uh, the only footnote to it is 9 million alcoholic Americans. I think now there's about 15 million individuals experiencing alcohol use disorder from, again, NIAAA. But that poster said it all. And what a great way, I thought at the time, again, looking back on it, at the time, I didn't realize the powerfulness of this poster. Okay, what's this stamp doing up here? I'm not trying to tell you that things are a lot cheaper in 1981, but they were. But a quick story on this stamp. It was put out in 1981 because at that time, the Betty Ford Clinic out in California had opened. A lot was being done in the field, getting the field off the ground in terms of alcoholism rehabilitation. Okay, and so the field and American Medical Association combined with the United States Postal Service and said, let's get the word out. Let's try and destigmatize alcoholism. Let's show that there's help out there. You can beat it. Okay. And this stamp was put out. I saved a little roll for myself. I'll tell you, when I bought it, I was working in the field and I just thought it was the greatest thing. However, unfortunately, it backfired. Okay. Anybody want to take a stab at why it backfired? It's a tricky one. Okay. Let me tell you, it backfired largely because of stigma. The recipients of any kind of item being mailed, okay, letter, card, whatever, the recipient of the mail became fearful that the mail carrier, the people working in mail offices and all, might see that on a stamp, and they might assume that the person with the address on it has an alcoholism problem. Okay, so people weren't buying the stamps, to the tune that this was the poorest selling stamp ever put out by the Postal Service. So that says, I think, that says a lot about stigma and how stigma, people were fearful, so fearful of, any association with their name on something like this with the coming through the mail system. And pretty, I thought, just, a reflection, maybe a reflection of there was a lot of stigma going on back in the day. There was. And again, it's getting better. And I want to keep emphasizing that. But that was just something that I thought was really interesting back in the 80s. This is how it really started to come around. And I see some chats and I want to get to them. I'll get to them right after this. This is where it came from. Michael Botticelli, he was the director of the former director, National Office of National Drug Control Policy Office, rather. There's a quote from him. These are issues and these are words that have a dramatic impact on both clinical care and about how medical professionals actually see and treat people with addiction. All right. He looked at the playbook that we have in our field of addictions, and he looked at the language, and he basically said, "Holy smoke, we got to make changes to we got to get a look at the language that we're using because it greatly affects our patients, our individuals who want to come for care." Again, shout out to him and his office for having done that. And his office still continues to do things. So the screens that I'll show you at the end towards contrasting the terms and all, it really largely comes from his office and all his work. Okay, Carolyn, if you'd like to share anything that we have in the chat that maybe we want to look at right now, just a quick commercial break.
Absolutely. First,
Thank
we
you,
have Janet
Carolyn.
sharing with us about her denial for short-term disability for depression. And unfortunately, this is something that happens frequently, and it really draws our attention to more advocacy in this area as well. And then we have Amber and Vicky and Matt sharing and Sean as well about language used to describe individuals who may have a gambling condition or a substance use condition as well, and the importance of not labeling as an illness.
Mm.
And Sean ends with a very profound statement in regards to the power of life and death lies in the tongue. So the words we use are very important.
Very powerful. Thank you all. Thank you, Carolyn, for sharing those comments. Very, very on point. Okay. All right. We'll move on. Stigma and words. We kind of talked about much of this. I want to make sure we have enough time at the end to close things out and leave a little time for comments. These are, again, these are terms that we hear, and you are what you label me. How true. Sensationalizing addiction and generalizing. Look at the tabloids and all, and you see how sometimes you'll see how it's glamorized, unfortunately. What words do we use usually as stigmatizing words? Well, there's a whole bunch of them. We don't need to go over them because we're familiar with them. Again, I think the amount of times that we're using them is a lot less, but I think they're still out there. In our field, the gambling disorder, we're still hearing gambling addict, even the term problem gambler, and we're going to come back to that in a bit. Degenerate gambler is really a very painful term when I hear it, because sometimes it's, again, it's just very stigmatizing. I'll say it that way. I think a gamblerholic, I think that's someone with alcohol, alcohol, money, and woman issue. Okay, Chisler, I'm not sure what that one is. Well, of course, we know that's the high roller. Okay, the high roller. And Chisler might be one too that spends a whole lot on gambling. Okay, and the others you're familiar with. I'm sure you've seen them more than once. Back in the day, Division of Mental Retardation in New Jersey changed their name to DDD because that was a highly stigmatizing term. And again, the field and developmental disabilities just didn't know enough at the time. And that was the term, that was what they used for their agency. But again, it's all changed. In New Jersey, drug courts were changed to recovery courts. Why? Much more empowering. Much more positive. Okay, and drug courts, that's in New Jersey, that's been in place since the early 90s. So that term was there for a long time, but again, change, and it's good to see that kind of change. With both cancer and HIV, when stigma was reduced, lives were saved. And the same can be true of addiction. Shatterproof, that's a great organization, private nonprofit. But the point being, with cancer and stigma was reduced, lives were saved. Okay, so what do? We want to combat it. How could we do that? Well, be part of the solution, become a student, watch our language. Okay, stigma's greatest enemy is knowledge. Addiction is not a moral failing. That's our former governor, Chris Christie, when he spoke in February 17. I was there. He was getting an award, and it's not a moral failing, not by any means. Watch your language, okay? It doesn't, addiction and mental health disorders don't describe what a person is, it describes what a person has. Okay, don't sensationalize the terms because addiction is treatable. I kind of like this one because person first language, and that's what we're coming to. It's got to be about person first. If we see our client, who are our clients before they came to us? Maybe we want to think of it that way. Who were they? They were people. They weren't addicts. They were people. Okay, so if we think of them and talk to them as person first, that will help stop stigma. That will help support recovery. That will certainly help the person. Let's talk about the person first language then. Stigmatizing language. Problem gambler, compulsive gambler, disorder gambler. I think we all use this, and I still do. And I'm trying to correct myself, but you listen to Dr. Lori Rugel and how she says that these are the terms I just used, they're all stigmatizing terms. They're all labels. Problem gambler is a label. And we don't want to be labeled. I mean, think of it. If we have a loved one in our families who's suffering from whatever they're suffering from, would we want to call them well, problem gambler? I think the more respectful and less stigmatizing, much less stigmatizing term is a person experiencing gambling problems or a person experiencing a mental health disorder. An addict, well, it's a person with an addiction. An alcoholic, alcohol problem, and on. And the list, we'll get to the list later because it includes more terms, but this is how the Office of National Drug Control Policy reworked our language. Okay? Don't generalize about people with addictions. Watch your language here, and we'll hear that, oh yeah, they have an addictive personality. That's why they're that way. Um, George Valiant, MD psychiatrist who did a lot of work in our field. Someday, if you have a chance, read his work because he clearly describes how there is really, in actuality, there really is no, quote, addictive personality. Don't use substance-related terms as metaphors. Don't say addicted to power, chocolate, whatever, because it diminishes the meaning of addiction. Avoid statements such as come back when you're ready, or I'm not going to work harder on your recovery than you are. Oh my God, when I worked in treatment, again, I still hear some of that sometimes. Don't allow clients to diminish themselves. Have you ever heard people who are in treatment refer to themselves as convicts or inmates? I have. When I used to monitor the treatment programs in New Jersey, especially the inpatient ones, they weren't locked down. Uh, but sometimes clients are referring to themselves that way without any criminal justice involvement. Watch your language again, GA, AA, NA, and all. Well, some of those meetings still have a good amount of stigmatizing language, and sometimes it's from individuals who identify themselves. And as I said earlier, that's quite okay. But sometimes um, it's a little more than some clients can handle. So for clients who can't handle some of that language, you might want to suggest smart recovery and celebrate recovery as possible options. And if stigmatizing language, well, what I just said, yes, try and give them another option. Okay, some prevention strategies for you. Learn more, okay? Learn more about this area of stigma. Go back, teach your staff, spread the word, get the word out, because the misinformation and prejudices and the adverse effects of stigma still continue, and we want to challenge those. We want to elevate our thinking and our work with our clients. Keep hope alive. Experience shows people with addiction disorders, severe mental illness can live happy, healthy, fruitful years. We know that. We've had clients being able to reach those points. Treat people with any type of disorder as people. Okay, here's the chart I referred to earlier. I'm watching the clock. I see 12:48. Okay, let's see. All right, so here's again the current language, alternative language, and the reasoning for that. I won't read all this to you, but it's all, again, it's all in place. You can Google anything on stigma and you'll likely find here the reasons and the change in the language. And again, it's very helpful to clients and family members. You'll see, just Alex is an addict. Well, the second one, Alex is addicted to alcohol. Alex is a person with a substance use disorder. Alex is in recovery from drug addiction. Many options rather than saying Alex is an addict. What and the reasoning for it? Person first. Avoid defining the person by their disease. The language of recovery again, the terms that are so often used. Some of these terms, again, they've been around for as long as I can remember, and before that, I'm sure. Okay? And they're not going to go away so quickly. It's evolutionary, but it's a change. It's a change in our language. It's a change in how we approach clients. And also, it's a change in how they will respond to us because they will hear what you're saying to them in a much different context. Recovery needs to come out of the basement. We need, and this is again 2015, I guess, maybe a little sooner. We need a new language, a logo, T-shirts, a theme, song. websites, TV ads, posters in buses, sobriety bars. We are start getting more sobriety bars. I see that. One of my sons lives in Philly, and it's good to see that that's happening. A recovery caucus, celebrity spokespersons, a corporate sponsors. We need public relations, attraction, not invisibility. How true. Shout out to you, Mr. Fleming, Recovery Works out of DC. Check your program, check yourself. Is it recovery oriented? Okay. Is the name's so important. They've done research on this. Names of treatment programs where the names are empowering and positive and not in any way stigmatizing. Not only do they have more clients that they get, but they also have results that are more positive. I had a program in New Jersey. They're getting off the ground. What was it? The name of it? I'm trying to think. Last Chance. Last Chance was their name. And I talked to the director and I thought, you sure you want to name it Last Chance? To me, that's not, I don't think that's the best name to use. He did. And unfortunately, though, within a year or so, they had to close and they didn't get enough clients. I'm not saying the name only was the reason, but it wasn't the best name and maybe had something to do with it. Get your staff trained in destigmatizing language. Is your program accepted in the community? Reach out. If not, reach out. Have open nights, family nights, because those family members who aren't in therapy, they probably don't have a good idea what goes on behind your doors of treatment. Get them involved. Offer that once a month. Destigmatize what you're doing because you're doing so much good work. Let the community know about it. Chances are the word's going to spread. What are your personal beliefs about why people become addicted? Something I talked about earlier. What attitudes, what beliefs might we have? Because sometimes we have to check those beliefs. Okay, we have to check it. And do we sometimes, if we're in recovery, do we think, well, clients should be recovering in a manner I recovered, like maybe my way is the best way. And we do know that there are multiple pathways to a person getting well, okay? And do you accept certain types of addictions more than others? We talked about that too. Is gambling considered not high on the priority list? Oh my goodness, I'll be real quick with this. But years ago, they did a survey of parents with teenage children, and they had they identified 14 areas ranging from bullying, sexual behavior, alcohol, drugs, body image, you name it. 14 characteristics. And they said, rate these. Gambling was included there. They said to the parents, rate these in terms of the level of concern you have for these areas. Wouldn't you know, gambling came out the very bottom. 14th out of that whole list. Gambling was the last. I think it says something about parents and what they need to learn. Do you believe some people are behind or beyond help? Oh my goodness, they can't come back to Earth Center. They've been here too many times. I've heard that one too. Do you believe certain drug treatment approaches are better than others? Another question there. Do you believe that recovery must look a certain way? Or maybe my way. Do you believe the words you use support that addiction and mental health disorders are conditions from which people can experience recovery? Again, some more strategies. Demystify treatment. Provide detailed information regarding what's going on in treatment to clients and family members. Demystifying recovery. Okay, not success failure. Improvements are often incremental. It's progress, not perfection, like the program says. Have people in recovery share their stories. Real quickly, there's a stigma-free campaign municipality toolkit. It's in Bergen County. It's the northernmost county in New Jersey.
I would rather be tired than have a migraine.
Okay.
Oh, excuse me. There's somebody, if you could please mute yourself.
Thank you, Carolyn. Okay, this toolkit, you could Google it. It's a really great toolkit. You could think about starting it in your respective area. It really gives some good ideas in terms of battling stigma and trying to help, okay, trying to help agencies who realize there's an effort here in terms of stigma. Real quick, because I know we're coming up to the end. Stigma, I'll just go to the middle one. Stigma is not alleviated solely by educating people on the science of a disease. Partly, it requires facilitating contact between a stigmatizing group and the wider community. Empathy and compassion can then begin to replace judgment and fear. Dr. Volko, who heads up the NIAAA, let me tell you, or National Institute on Drug Abuse, rather, that's also powerful. And here's the link, all right? When I said about HIV/AIDS, when Magic Johnson, the famous and probably one of the best basketball players ever professionally to play the game, when he came out in 1991, and he let the world know, okay, that he had HIV, okay, wow. Did that destigmatize, did that help destigmatize the medical profession and also society in so many different ways? And Magic's message was, again, part of a message was you don't have to be gay to be able to contract this. And it was like, it was an tremendous strengthening message that he gave. And at that time, and from then on, so much was done in the field of HIV/AIDS that was so necessary. Again, a shout out to Magic for sharing this story. New York Council has this wonderful poster. Can you identify the person who is struggling, okay, with gambling addiction? Who are they? Could be anybody. And again, wonderful poster that they have that, again, destigmatizing our gambling addiction. Celebrate recovery. Again, encourage people in recovery, have them share their stories and speak out against stigma. Learn more, see the person, not the condition, take action. These are some of my works cited. I'm back to Carolyn. I went on rapid fire the last 10 minutes. Oh my God, I'm taking us beyond. It's 12:57. I want to leave more time. My apologies. Anybody wants to just jump in? Carolyn, you be the leader, please.
George, we appreciate your enthusiasm and thank you so much for an excellent presentation. I'll say, the Virginia Council, we did a similar ad campaign with the Virginia Lottery. We've out just the video of that about, can you recognize the person with the condition, and
shout out to you guys.
Yes. And there
Great.
was Tom asked about the PowerPoint, so I did attach them in the chat. I can send those forward as well to anyone who would like them. And please, if somebody has a comment or a question, unmute and share.
I have a comment. George, your everything you said is so right on. The thing I'd like to add is that if the helping profession, medical and behavioral health, would even ask the question about gambling, because it's so rarely even asked. And as a result, lots of people aren't getting the care they deserve.
Amen, Don. So well said. There are not enough programs. Doctors are trying to screen. I approached the Medical Society in New Jersey years ago, and I asked them, could a question be included on their intakes for the docs to ask about gambling? And my response was, doctors don't have enough time. But I'm not going to give up, because this is what we heard about tobacco years ago. This is what we heard about some of the other things that have been changed. So we're going to keep pursuing it. Thank you, Don, for your comment. Carolyn, you made my day when you said the council in Virginia has already done some of this with the lottery in Virginia. That super. I mean, I can't be more happy, because unfortunately there aren't a lot of councils who've taken the kind of step that you have. So again, thank you, Carolyn, you and your staff. Okay,
Right.
anyone else before we close out? Anybody wants to email me? I like to read emails. I used to work for the state a long time, so I'm used to emails. Even phone calls I like. So you have it. I think it's on the PowerPoint in the beginning. So anybody wants to just reach out and have a thought or two, I'm always open to that. And I look forward to meeting you, Carolyn and Don, and the rest of you someday in Virginia. So, again, it's been a pleasure today. Thank you so much, everyone.
Thank you, George. And thank you, everyone, for being with us today. Enjoy the rest of your day.
Thanks,
Take good
George. Be
care, all.
safe.
See you.